So in law school, you can kind of like start to kind of branch off in these little areas where you might want to go like after you graduate. Is it similar in physical therapy? And like what could those possible tracks look like?
Yeah, so there's just different settings that we can practice in. And it can be inpatient, outpatient, so in hospital, out of hospital.
Okay.
You can do specialty clinics like a dizzy clinic, so specifically for vertigo, pelvic floor. If you want to go to a sports rehab center where it's more sports medicine, there's all those options, or a cardiac rehab, inpatient trauma. My favorite was the CLC at the VA, so the Continued Living Center, CLC, yeah. And mine was all stroke patients, stroke, prosthetic, cancer, helping within our VA system. It's where everyone goes right before they get discharged if they need continued care.
Yeah. So, man, there's so much going on that it's like, well, how do people typically figure that out? Like, you know what I mean? Like, I guess I'm assuming like there's some people like that don't necessarily know where they're going to go right out of school, but then there are other people that are like, this is the direction I want to go, and I'm already going now, or, you know, like my second or third year. And is that pretty typical in the physical therapy world?
A lot of PTs go into it thinking, I want to be sports med. I'm going to work with teams, or I really like working with the geriatric population.
Okay.
I'm one of those, though, that as soon as I started dipping my toes into the different pools, I said, oh, I could do ortho. Oh, I could do peds. Oh, I could do inpatient. I loved all of it because it's all so different, and it is so cool how you're still in the same profession, but you're doing completely different things.
And does the school, do most schools kind of give you that opportunity to kind of like dip your foot in like different pools of water, or is that dependent on the school?
It's dependent on the student.
Oh, okay.
Do they take advantage of the different settings? A lot of people are nervous of trying something different. So a lot of people's experience is in orthopedics. Our school mandated that you take an inpatient rehab center. So that was really wonderful. It forced us out of our comfort zones. Everyone had to do inpatient. But it's really up to the student. You know, are you going to take advantage of all these opportunities, or are you going to stay close to home?
So what would your advice be then, looking back?
Don't be scared.
And do what with that?
Don't be scared. Try something new every time. Every single time. If you want to repeat anything or like repeat a setting, do it for your last one. Because you're not going to know that you want to be in that setting until you've experienced it. You know, it really takes working with kids to think, I like kids, or I don't operate well with children.
For sure. Definitely. Yeah.